ABC of pre-hospital emergency medicine, one of the reference of this course. Pre-hospital emergency medicine, edited by Tim Netbeam, Matt Bolan, Caroline Leach, Claire Bosanko, 2023. This is edition 2023. Operational practice, activation and deployment, responder safety, extractions, the first 5 minutes and the primary survey, airway assessment and management, breathing assessment and management, circulation assessment and management, pre-hospital monitoring, pre-hospital ultrasound, analgesia and sedation, transfer and retrieval, providing pre-hospital trauma care, abdominal injury, pelvic injury, head injury, spinal injury, extremity injury, burns, suspension and crush injury, ballistic and blast injury, cardiac arrest, acute medical emergencies, overdose and poisoning, special group, pediatric patient, obstetric patient, bariatric patient, older patient, mental health crisis, environmental injuries, drowning, diving emergencies, altitude illness emergency, preparedness, mass, causality incidents management, chemical, biological, radiation, nuclear incidents, mass gathering, clinical governance and professional skills, clinical governance, medico-ecological and ethical aspect, human factor, human performance, research and the development. This is the contributor, the list of contributor. Here, this Dominique Lehari, a French surgeon and military doctor, practiced in the late 1700s, is often cited as the father of modern day hospital emergency medicine. His vision and commitment to provide care at the point of wounding, triage his patient on the basis of clinical need, and transport to battlefield hospital in the flying ambulance was the blueprint of present-day pre-hospital practice. In the face of adversity, he provided contemporary medicine where patients needed most, and at the same time created innovative practices such as triage. Such achievements remain inspirational today. The roots of pre-hospital medicine by the measure are admitted when compared to those of old medical establishments that can trace their practice. The first edition of the book was conceived 15 years ago. Pre-hospital emergency medicine, in the operative practice, the activation and the deployment, responder safety, extrication, the first 5 minutes and the primary survey, airway assessment and management, breathing assessment and management, circulation assessment and management, pre-hospital monitoring, pre-hospital ultrasound, analgesia and sedation, transfer and retrieval, providing pre-hospital trauma care, abdominal injury, pelvic injury, head injury, spinal injuries, extremity injury, burns, suspension and crush injury, biliastic and plastic injury, cardiac arrest, providing pre-hospital medical care, acute medical emergencies, overdose and poisoning, special groups, pediatric patient, obstetric patient, the bariatric patient, the older patient, the mental health crisis, capacity, environmental, environmental injuries, drowning, diving emergencies, altitude illness, emergency preparedness, mass causality incidence management. Chemical, biological, radiation, nuclear incidents, mass gathering, clinical governance, professional skills, medical, legal, and ethical aspects, human factor, ergonomic safety and culture, human performance, research and development,